97% of Minnesotans live within 30 minutes of an acute stroke-ready hospital. When every second counts, having access to an immediate care facility saves lives. How do you know you're having a stroke? Remember the acronym, B FAST. B is for balance loss. E for eyesight changes. F for facial droop or numbness. A is arm weakness. S, speech difficulty. And T is for time. Remember to call 911. Not all strokes look the same. A person can have one or many different symptoms. Don't wait. Call 911 and never drive your loved one yourself. Emergency medical technicians can begin stroke treatment in the ambulance and alert the hospital that they're on the way. Physical and cognitive damage is irreversible if treatment is delayed. Glacial Ridge Hospital is an acute stroke-ready hospital, a designated Level 4 trauma center, and a critical access hospital. As a rural hospital, one of 117 stroke hospitals across Minnesota, this readiness benefits the residents who live in our area.
When the EMTs notify Glacial Ridge they are bringing in a stroke patient, several procedures are immediately set into motion. The hospital activates their stroke team of lab, x-ray, doctors, nurses, support staff, and the neurologist at St. Cloud Hospital Stroke Center. The Glacial Ridge medical staff is highly trained in specific stroke procedures to evaluate, stabilize, and provide emergency treatment. When arriving at ER, a stroke patient is rushed to radiology for a CT scan to see if they have had a bleed or a clot. The Glacial Ridge medical team uses their telestroke connection to St. Cloud Hospital's neurologist for video and digital assessment of the patient's symptoms and to determine treatment. Glacial Ridge Hospital was one of the first hospitals outside of the metro to implement telestroke in 2010 with great success. As an acute stroke-ready hospital, Glacial Ridge is equipped and trained to rapidly administer TPA, the clot buster drug. If a patient requires additional intervention and catheterization, they would be flown by helicopter to St. Cloud. It's amazing to see people back here in our community walking around after the trauma of a stroke, many with no permanent long-term effects. From ambulance to hospital, and a virtual connection with a neurologist through the telestroke program provides better stroke outcomes for residents in rural communities. Highly skilled stroke readiness saves lives. Be fast. Every second counts.